Hello everyone, here we are at Richardson Hospital, the pre-op arena. This patient has just been shifted to the ICU. He's still in his casual clothes. We are going to prep him up for surgery today, which is going to be a bi-jaw surgery. By that I mean both the maxilla and the mandible. If you look at his profile carefully, I'll just look to your sides. He has a concave profile. So what we ought to do is make it into a straight profile. He has a classical skeletal class 3, angles class 3 malocclusion. So which means his lower jaw is prognathic, forwardly placed as compared to his upper jaw. So we intend to move the upper jaw forward and do a mandibular setback of about 5 mm, which will give him angles class 1 occlusion, a bite, a normal bite rather, and he will be able to chew properly. And although functionally his concerns are not to do with chewing or the malocclusion, it's majorly to do with his profile, his forwardly placed jaw. And a very interesting thing is he's a tennis player, yeah, and we are proud of him because he's represented our country, and kudos to you for that. So what he says is he's not able to his airway breathing difficulty. It does happen because of the placement of the jaw in such a position. So this maxillomandibular surgery will improve his airway and give him a good airway passage. Also it will help him with the occlusion and profile correction. So overall we are going to do a lot of work on the upper jaw and lower jaw. Also once we do the setback, we are going to do some work on the chin to give him a nice contour to his face. So it's going to be a bi-jaw and genioplasty. Alright, you have to say something. He's quite nervous. If possible, we are going to bring in his mom also to say something because she's really nervous, even more than him. I wish she was here to tell.
Hopefully everything goes smoothly.
Yeah.
That's all.
It will go smoothly. You don't have to worry. You are in good hands, and Dr. Richardson will take over shortly.
Work on the septum. Upper jaw is going to get advanced. You can see he's got asymmetry as well. There's a midline shift corresponding to the shift in the chin. So it's also facial asymmetry plus a concave profile. His face is way too long. We're going to address all of this in one go. So we're going to be working on the cheek, the upper jaw, the base of the nose, ramus, and eventually the chin. This is him just before we start. And you see we've given him anesthesia through the submental route so that we have the entire face open for us to be able to do our surgeries. So we've completed with this face makeover, bimaxillary surgery, genioplasty type of a surgery. So you can see the current occlusion now. So you can see how the underbite has been totally corrected. Yeah, and you have very good occlusion. We're also going to show you how we've got his whole face transformed. Just completed with this face makeover surgery. We're going to show you first how he's looking right now from different angles, and then we're going to show you how he was earlier. So you can see he's got a nice proportion now between his upper jaw, lower jaw, upper lips, lower lips, nasal base, chin and cheek. Earlier that wasn't the case. His face was concave, he had a very long face, and he also had incompetent lips, he had underbite. So we have taken care of all of that in one go. He also had facial asymmetry that we fixed, and so we're going to show you one by one. So that's the front view now. So you can see the huge improvement. Side view. So we show you you can see that. So you can see that His entire face has been improved. So check the lower jaw, check the upper jaw. Now you can see the proportion, and all of that has been improved. Yes. Right. Now we're going to show you the front view. Yeah. So his face was concave. It was a concave profile. Very large, protruding lower jaw with underbite. Yeah, we can also show you his current occlusion. Can you put the... So we're going to show you how his occlusion was before. So you can see this. So this is clearly the case when the upper jaw was way too inside. This is what we call as severe underbite, and now we've corrected that. So you can see the bite. So he's got a nicer bite. Keep the other one that side to the left. And this was how he was. So you just see the upper teeth where they were and where it is right now. So that was before when we started. So this is right now.
So hello everyone, this is post-op day 1. Yesterday was his surgery, and you see a lot of bandages here. Let me tell you more about the surgery. It was a bi-jaw surgery where we have performed a LIFO-1 osteotomy advancement. Also, we have set back the mandible, so we have done a bilateral sagittal split osteotomy with a setback. So if you see his pre-op occlusion was a ideal class 3 occlusion, so which means his lower teeth, he has a reverse overjet, his lower teeth were more forwardly placed than his upper. And right now what you see is, although he has a lot of edema. How's your pain? Are you having, it's okay? Do you have pain on the lower jaw more than the upper jaw, something like that? No, it's just okay, it's mild.
Yeah.
All right. What are you eating, drinking? Liquids. So this is something very painful for a person, especially he's an athlete, so his diet is it's quite a lot, I believe, and for a person like him to just have juices post surgery for a period of few days till we tell him, give him clearance for soft food, that is the difficult part. So coming to the occlusion, as you saw, there was a reverse overjet, a prognathic mandible. His right now his bite, yeah. So his upper teeth are almost 5 mm ahead of his lower teeth. Also, there's a lot of swelling over the lip. All this edema is going to come down. We've also done a genioplasty for him along with the bi-jaw procedure. So his chin is quite symmetric now. He did have, so this is how he looked, and this is how he looks first day post-op. So if you see his profile on the side view, you'll be able to appreciate better. The main thing to notice here is the prognathic mandible. Can you look towards the side? Yeah. So right now he has a straight profile. His chin is quite prominent now, and it's unlike this where his mandible itself was prognatic without any jawline. We have removed all the jowling that was present for him. Alright, so in terms of pain, he says it's okay. Edema, it's visible. It's considerably the usual kind of edema we expect post surgery, nothing more, nothing less. Edema is likely to increase tomorrow, and then slowly it settles down from, say, post-operative day 3. So this is why we are following up this patient particularly, and we show you how much, and we ask the patient how is his state, so you get an idea as to what goes into a bijaw surgery even in the post-op period. You want to say something? No? Okay, you can rest. Alright?
Yeah, this needs some cleaning. Knee sound. Okay, bite. Open. Bite. What we need to do for him is to put some, remove all the sutures and maybe put those braces and slight guiding elastics and coronoplastic. Tomorrow, all of this for him. Right? Yeah, I think it's what, 10 days or more, right? Especially, and then open your mouth, bite, open, mouth opening is also pretty good. Show me on the phone now. He's fine. Because we removed the plaster long ago. Yeah, so you can look this way. So the bite is still not like really perfect. So we're gonna just do some procedure for that tomorrow. For the side views, so you can see the maximum improvement in the side views. So this is 10 days after bijaw surgery. We've got the upper jaw forward. We've taken the low ones. Well, actually not backwards, but rotated it. And a similar view, a similar thing you can see from this side. And open your mouth now. Okay, straight. Some more. That's the maximum. Okay, bite. So that will also improve. Mouth opening will improve with time. Okay. You're not having any pain anyway, so that's going to settle. The bite we're going to fix a little bit, and also try to put some braces and put some elastics. Okay. These are things that will help the teeth to just, guide into much better centric occlusion, as we call it. Okay. All right. Right, that's the only thing, and then you can go on with soft solid diet now. Anything that's soft can be eaten, chewed, but not anything that's hard. And what happened? You want to take the...
There are our dimples.
Oh, he wants dimples.
Sorry, doctor, he is feeling numbness in these fingers. Numbness in these two fingers.
Is it because of what?
I don't know. I think it's since the...
Injection? No.
Because it's very...
Numbness where all?
Huh?
Where all do you feel numbness?
Here. All over here.
Is it tingling?
Yeah, it's tingling.
Anything on that side? That's weird. Since when?
After the surgery. Ever since after the surgery.
Okay.
And, when you remove the needle and put it here,
Yeah.
I've been feeling like a little discomfort, and then it's not healing. It's not going away.
It's just feeling tingling.
Yeah.
It doesn't come with the IV, but we'll get another doctor to have a look at it. Because we put it here and it can't cause tingling and all that.
Yeah, this is
All right. Then Anantha Krishnan, I will look at him. Who's that?